Well, greetings again. This is Dr. Bill Wyatt, and it's 3 days after my 97th birthday, and I'm going downhill mighty fast, and I don't know how much longer I'll be able to continue the videos, but I want to come back and redo this old patient I had several years ago. I think about 8 years ago we did it, and the sound wasn't good, and this was a real favorite patient of mine, and I've known her for a long time, and so I've come back to redo it again, and I hope that I'll be able to get through it here. So let's get started. She is a very nice lady, and she had a terrible deep bite, and I'll just get that going. And let me get over here and make sure, well, we got our little dot going, and I'm gonna start showing you her stuff. And she has a very short lower third of the face and everything, and this is not such a good picture of her, but it is. She's a very nice person, and I'm going to go ahead and let's see. Here's a little smile she's given, and you can see the teeth in there, and that's a little side view, another profile view, and this was done years ago. She's 71 years old there, and I guess by this time she's be nearly 80 years old. Now, she had a tremendous deep bite, and it was thought for years that people couldn't straighten old people's teeth, but you can do it, and I wanted to make sure everybody realizes that we have come up with a system of doing orthodontics that covers every movement that you can think of in the teeth. And I've tried to work out something where there's no movement of the teeth that you can't do with a straight wise system. And it just hasn't caught on yet, but I hope after I'm dead and gone that people will come into doing that. So anyway, here she is, about 70 some odd years old, and she's probably 80 by now, and she's got a deep bite. You can't even see her lower teeth. Now we're going to intrude these upper teeth. We'll go up in this direction, and the lower teeth, they're up in the roof of the mouth. We'll push them down like that and open this bite up. And we do it with intruding arches. Now on the side, it's fairly close to class 1 case. And over here, it's about the same way. It's a little more class 2-ish on this side. Now as we open the bite, we can slide the lower jaw forward. Now, if I open the bite to where it's edge to edge, there's a big gap on both sides. This one's about as deep as this one over here. Don't look at it in the same angle. And we're going to need to pull these teeth down and take these teeth up. And the bone structure moves with the teeth. You move a whole group at once. And this is something I want you to know, that this is the way it is. These teeth right here are higher. They're going to go down. And you'll see after we get them down, the clinical crown looks almost the same. Now this is stuff that happened years ago. We've been doing this for years, and it just hasn't caught on all over the world. Thank God for YouTube, and they came along just after I quit, and I started putting these videos on to show how teeth can't go. And you see, it's a kind of a class 2, division 2 anterior part with the upper centrals kind of leaning back and the laterals coming out to the side like that. She had some tori in her mouth. It didn't seem to bother her much, and so we did not mess with them. But if you had to, you could lay the gum back and go in and grind these off. I did my father's like that when he was in his 70s or 80s, something like this, but probably just in his 70s. But, and I did it while I was in school. Now they don't let students do that stuff now, but I mean, the students doing it, but we did it back then. Now, you look at the upper anterior teeth, you see some imprints like that in the teeth. You don't see much. If I come in and look at our models now, you can see where these lower teeth fit up and against the upper teeth. Now here we go into her models, and this is 2 of 04, and you can see how deep it is. Looking at it, this is more of a class 2 relation. You need this 6-year molar needs to be somewhere like in this. In other words, it needs to come forward about 2 or 3 millimeters at least, and to make it fit correctly. Over on this side, it's class 2-ish also. In other words, this 6-year molar needs to be, I did like that, for that to be correct. So as we come down with these and up with these, there'll be room, and we move them into that space. Now, looking at this point, that's just a little closer. We've got some duplications here. All right, this is the Archwire. This is the Intruding Archwire. That's not a clear picture of it. Now, we took the models and we just looked in from the back side. So the lower teeth are right up against the gum in the upper arch. And we're going to bring all these teeth down here. Here is the x-ray. And I took the x-ray, I always had them bite together, and I took the x-ray like that, so it would give me a picture of how deep the bite is. I didn't hear the lower teeth go up to here. So we're going to have to open this like that. And she's age 71 and maybe 11. She's almost 72 years old, apparently, there. Now, there was no wisdom teeth in there at all, except maybe over here on this left side, right here. But you can see it's more class 2 over here, and it's almost about halfway to class 2 there. Now, that's fitting in upper groove like that. All right, we started off just to get some brackets on the teeth. This thing here is slid off. This would be up in here, and she was biting on that so we could get brackets on those lower anterior teeth. And then we'll move these teeth out and up. And there'll be more room in there. So here is the deal going again. Now we look at here, we got arrows coming down in between those teeth. Now here we come in and put the intruding wire in, and now we have raised these teeth all up like that, and these teeth have gone down, and now we've got these almost together back here in the back. They're going to come together, and we're almost in class 1 now. See this tooth is moved out there. Excuse me. Now here she was when we started, and she was 71 and 11 months old. She was 72, virtually 72 years old here. Now, if you notice, there's a very short distance between here, so we're going to increase that a little bit when we treat her teeth. And this is an 05. We've come in, we've got brackets on our teeth, and we have raised these teeth from where you couldn't see anything. Now part of this is this going down, and this is leveled out now. And the way we did that is the way we've done many old people's case. And if you will look, the clinical crown of the teeth is almost exactly like it was. The teeth didn't go into the bone, but as you move the whole group of teeth went up and carried the bone with them. And this is something, and people, whoever got this idea going, that old people's teeth would not move and their bone wouldn't move. This is so wrong. This can be done as long as you are living. You can have this done. And I'm going to join the other side, but I want that to stick, and it is true. It is the absolute fact they can. I like to use these little single brackets on some teeth. I use a wedge like this to rotate them a little. And down here we put double brackets. I don't know why. Maybe we didn't have the single ones to put on back then. And brackets are far better than bands on the teeth. If you had bands on there, you could not tell exactly how much torque in the tip and everything would be when you get through with the case. So here we're wearing some class 2 elastics off of the lateral up there. It should be off the cuspid, but we're pulling the lateral over, and then we'll close that space up. And on the bottom, we're doing a very similar thing, and we're closing this, tightening this up down on the bottom. The tori, we work on the outside. We don't bother it at all, just left it alone. Now you stick a mirror right on top of the lower, the lip, under the lip, and you can take a picture of how you're meeting, how the teeth are meeting up above. All right, this is my card on this case right here. All right, it's 105 now, and we've got that opened up. And the class 2 virtually corrected. Now this is 9/16 of '05. And we're almost finishing the case up. Now the laterals were too narrow to fill that. Seemed like we did something. We built the laterals, widened them up or something to fill that gap. When I had these interdigitating back here, we had this space up here, and we had an overjet and overbite like we should, and the laterals weren't quite large enough to fill it. You can look at them and see like they're very small teeth. On the bottom, we got them together. Everything lined up pretty good on the bottom. So we're going to have a little gap on both sides of the laterals. Now here she is in '05. Now we put these intruding archwires. If you notice, this comes like this, like that. Now it goes down. So you engage that in this tooth right here, and it'll bring the anterior teeth down. This wire will be brought up and hooked to them. And that's the way we open the bites on people. And it'll open anybody's bite. It doesn't matter what nationality they are, or how old they are. You can open anybody's bite with it. Now these laterals are just too darn small right here. All right, we apparently built some little caps to go on those laterals to fill that gap up so that we could have these teeth fit in the place we should be, and this would hold it up, and we'll put a bite plate underneath that. When we finish the case, we make a retainer, and we hold, and we have it finished like we're going to do it, and we take an impression of that, and we build a retainer. I even make the retainer take the impression while it's still. I just take the archwire out and take an impression right then, and we get it to do. So I can tell the person what you see right now is going to be what you get. Now, on cases where we ban this, after we finish, we bring them forward from the back front by using the retainer in here, and we close that up. This stays the same all the way around. The bottom looks like that. We come off of it. So here let me go back now. Here are the crowns on those lateral teeth. Now, here's the model when we started. And we're going to take this cuspid, put it back there. We're moving this back here. Except we're not moving, we're moving this up forward. Here this case is temporary crowns. Those are some temporary crowns on the laterals there. Now this cuspid is right on the money. These teeth are on the money. That's the 6-year molars are moved correctly, and the lower teeth are correctly. And see that? Look where the cuspid is now. Look where it was. So now it's '06. This didn't take forever to do. We could do somebody, I could work on adults and finish them frequently in about the same time as young people, young, in the early 20s and things. I could do just about as fast with those. Now there is a world of orthodontics out there on people in their 50s, 60s, 70s, 80s, and it can be done. I never started in about the 90s, but I have moved over into the 90 on a few cases. And they can be treated, and the time is really not any further. I found that I could work on the adults and move their teeth about like doing on young people. And then if orthodontists would start teaching older people orthodontics, there's more of this out there, that we don't have enough orthodontics to even begin to take care of all of this. And I can't get that across to the orthodontic department around. I went and asked them to teach adults, and they said, we're not going to do this. And I said, this was years ago. I said, with God's help, if you're not going to do it, by God, I am going to try. And I have done that all my life, over 60 years now at this. And I hope it'll pass on to some company or somebody that will start to doing these adults like that. Now the profile, everything else worked out. One of those laterals was a root canal deal on it. She didn't have any wisdom teeth when I went in there. Now you can see these are in class 1 relation. Now the cuspids are coming right down in place where they ought to be, everything. And now we'll hope she got some permanent crowns on those 2 lateral teeth right there. And it's just a blow up of the same area. And that's the end of this case. And I hope to goodness people see this all over the world, that your teeth can be straightened. Don't believe. People come to me and say, do you still work? I can't work anymore. And I have given my I've worked about 60 years doing this orthodontics and pass it on. And we have over 1,000 videos out there now. And we have tried to group together different groups of videos that are covering the same fact. And a lot of these cases will have a whole string of things. And so they'll be showing up in that. And so you can come to this and thank God for the YouTube channel and the stuff that we put out did 8 years ago or 9 years ago when I actually retired from doing it. This will work, and people can do this as long as people live. So I thank you for watching, and I'm going to hang up and rest a little bit. Thank you, now I'll close out.